All right, we're on to page 250 of your lab manual under muscles in the standing position. We're going to worry about two in this position. The first is the gastrocnemius. We have two heads of the gastrocnemius going from up in the femur down to the calcaneal tuberosity, and we'll palpate this by asking the patient to plantar flex or go up on their toes, keep the knee straight, and feel for the muscle belly along the back. Now we can distinguish that from the soleus muscle by asking the patient to bend their knees and then go up on their heels. And now you're going to have to go a little more laterally or medially to find the soleus. Remember, the gastrocnemius is a two-joint muscle while the soleus is a one-joint muscle. On the bottom of page 250, we're not going to worry about plantaris, but we are going to move on to page 251 for the tibialis posterior. Now the patient is in the sitting position. We're going to ask the patient to point the toes down and in, and we're going to palpate behind the medial malleolus and in front of the Achilles tendon. So this is where we'll find the tibialis posterior. The flexor hallucis longus goes through mostly the same area. What we're going to ask the patient to do is flex or curl the toes, and the tendon is palpated posterior and inferior. So posterior, inferior to the medial malleolus, again, while the toes are curled. If we go on to the flexor digitorum longus, the cue remains the same. Curl the toes, and we're going to palpate in about the same area, posterior to the malleolus, posterior to the medial malleolus, and along the medial aspect of the foot. And you'll see in parentheses there, same as tibialis posterior. The tibialis anterior is palpated. This one is in the front. It's lateral to the crest of the tibia. You ask the patient to point their foot upward, and you should see the muscle come out here along the front. Extensor hallucis longus. So we see the word hallucis, and we're just thinking about the great toe. So you're going to straighten your great toe by pointing it to the ceiling, and you're going to palpate and observe the tendon as it crosses the ankle on the dorsum side of the foot, leading to the great toe. So right along through here. That's extensor hallucis longus. Now extensor digitorum longus is going to the other four toes. So we're going to ask you to point all four toes up to the ceiling, and the muscle will come along the top of the foot here. The last two we're going to worry about, fibularis longus and fibularis brevis. These are located along the lateral aspect of the foot. So the action of the patient is you're going to point your toes and move your foot to the outside. So point your toes and move the foot to the outside. Excuse me. The muscle belly is located along the lateral side and distal to the fibular head, and it goes all the way down to the lateral malleolus. So foot out along the lateral malleolus. The final one, the fibularis brevis. This is difficult to distinguish from the fibularis longus, but in its name it says brevis, so we do know it is shorter. So the muscle belly is palpated on the distal lateral fibula, and it goes from the inferior, it goes from the fibular head to the lateral malleolus. So it goes to here, and we're going to ask the patient to move the foot to the outside. And cut.